Hello everyone, this is Dr. Saroj Sadyate from the platform of UKMLA with DSS. And let's just begin our course and let's just continue our course and move on to the next lecture, in which we will be covering the structure or the approach that we have to take for the medical history taking base stations or the medicine topics that usually show up in the exam. Okay, and the sole reason why we are doing it at the very first, because this particular structure and this particular approach is what makes up the basic data gathering, okay, or which makes up the basics of history taking, because the components that are covered in this structure, the mnemonics that are there, okay, all of it is something that would help you lay down a very strong basics of history taking. All right, and then once you're able to master this, the upcoming specialties that we're going to do, they would become much easy for you. Okay, because there are not there, those specialties and those the approach that you need to take in those stations is not very different from the one that we are going to teach and one we are going to learn today. Okay, uh, you might just have to change and modify this particular structure a bit to make sure that your history is in accordance to the specialty that we are going to cover in the upcoming lectures. All right, so this structure is like very important. Okay, and before I begin the medicine history taking structure, okay, let me just share with you a list of the cases or the list of the symptoms in which you would be able to apply this particular approach. Okay, and just you just name any medical symptom. Okay, it can be chest pain, it can be headache, backache, stomach ache, it can be neurological complaints like falls, confusion. Okay, it can be complaints related to the urinary tract system, it can be complaints related to the breast, or it can be generalized systematic complaints like weight gain, weight loss. Okay, so whatever the medical topics are and whatever the medical differentials are, okay, and the presenting complaint that those differentials may present to you with, you can use the structure in all of these cases. Okay, in all of these cases. Okay, so if you encounter someone presenting to you with the concern of abdominal pain, or with the concern of diarrhea, with the concern of dysphagia, and if it's just a pure history based station, okay, then you know that you have to follow this particular structure. Okay, so yeah, let's just begin. Okay, so this would be how the case note would be presented to you outside the cubicle. Okay, and as I mentioned in the previous lecture, in identifying different type of station, there would be a symptom that would be mentioned. Okay, like for example in this case, a chest pain is mentioned. Okay, and the symptoms could have been anything: diarrhea, vomiting, weight loss, weight. Okay, now, what you need to do in this type of stations is, number one, you need to go inside, read the examiner, okay, and do the introduction in a way that was taught to you in the last lecture. Okay, and now once you're done with the introduction, once you're done with the rapport building, okay, and once you've asked the open-ended question, okay, that okay, Mr. Yon, can you please tell me more about it? Okay, and they're going to give you a few questions, a few answers, and they might address some of the questions that are there in this structure. Okay, but nevertheless you still have to follow the layers that I'm going to share with you. Okay, so after the introduction and the open-ended question, the very first layer, okay, this particular layer that is seen on the screen, okay, that is exploring the symptoms. Okay, and how do you explore the symptoms? Okay, there are two mnemonics that you need to remember. If the complaint is pain, okay, pain can be anywhere. It can be the chest pain, it can be a headache, it can be stomach ache, it can be back pain. Okay, if this presenting complaint is pain, okay, or headache, or any ache anywhere in the body, okay, then what you need to do is that you need to follow the Socrates. Okay, this is the mnemonic that needs to be followed. Okay, now what does the Socrates means? The S stands for the site. Okay, and how you're going to ask it? Can you please pinpoint the location where you're exactly feeling the pain? Okay, or can you please tell me where exactly are you feeling the pain? Okay, then you're going to ask about the onset, that okay, can you please tell me, did it begin suddenly or did it begin gradually? No doctor, it was just sudden. All of a sudden I started having a chest pain. No doctor, I was having some discomfort in my chest for a couple of weeks, and now it is increasing in intensity. Okay. So that is how you're going to ask about the onset. Okay. Then you move on to the character. C stands for the character. Okay. That can you please tell me, how is the pain? Is it a sharp pain? Is it a burning pain? Is it a throbbing pain? Okay. Is it a stabbing pain? So these are the few characteristics of the pain. Okay. It can be sharp, it can be dull, it can be throbbing, it can be burning. Okay. So you need to ask those 3 to 4 different characters and the nature of the pain. Okay. And then radiation. So what mistake people do in radiation is that they just end up asking the question that does it go anywhere else. Okay. And one very important rule of plateau that I would like to share with you guys over here is that always be specific. Okay. Do not just say does this pain go anywhere else, like where, what are you thinking? Okay, why are you asking this question? Okay. So whenever you are asking any particular question, it is very important to be very specific. Okay. And why specific? Because you need to have a logic behind every particular question, that okay, why are you asking this question, or are you just asking this question for the sake of asking it? Okay. Like for example, an average candidate, what he or she would ask that okay, you are having a chest pain, can you please tell me, does it go anywhere else? Can you please tell me if it goes anywhere else? Okay, that's an average candidate. A good candidate would ask direct questions. Okay. And the good candidate would explore the radiation of the pain in a much more specific way. Okay. And how will it be done? Like for example, can you please tell me by any chance if this pain goes to your jaw? By any chance if this pain goes to your neck? Or by any chance does this pain go to your left arm? Okay, so if you're asking it in a specific way, you're automatically giving that impression to the examiner that all right, he is doing Socrates, he's trying to explore the differentials. Okay. And he's trying to explore the symptoms. But whatever question he's asking, there is a logic behind it. He's trying to rule out a particular differential when he's asking about the radiation. Okay, let's suppose if I'm thinking about aortic dissection, let's say, okay, a patient with chest pain, and I'm thinking about aortic dissection, I'm going to ask that okay, by any chance does this pain go to your back as well? Okay. Instead of asking does it go anywhere else and then expect the simulator to say yeah doctor it goes to the back, and then okay, I'll think oh it's a aortic dissection. So automatically your history taking, your data gathering should be differential oriented. It has to be differential oriented. Okay. Then SOCR is done. Okay. Then A can be anything else. Okay. Association and anything else. Okay. This is something that I'm going to talk about in a lot of detail. Okay. Not right now, I'm not getting into a detail of it right now. Okay. But once I am done teaching you this particular structure, I'm going to share that what this association and anything else means. Okay. And then T stands for the time, basically the time duration, that since how long have you been having this pain? Can you please tell me when did this pain begin, and since how many days have you been suffering from this condition, since how many hours have you been suffering from these conditions? Okay. And then the E in the Socrates, then E stands for the exacerbating factor or the relieving factor. That okay, Mr. Green, can you please tell me, is there anything that makes this pain better? Is there anything that makes this pain worse? Okay. And that is one way of asking this question. All right. But if you're again, if you're being specific, if you're trying to elevate the level of your data gathering, you're going to ask a relevant question, and you're going to ask a specific question, that by any chance does bending forward releases your pain? By any chance does your pain increase when you try to take a deep breath? Okay, you're thinking about pericarditis, you're thinking about pleuritis. Okay. By any chance resting or sitting down reduces your chest pain? Okay, so you're thinking about stable angina that releases with rest. Okay. So always again, I'm saying this, that try to be specific. Okay. and do not just ask the questions for the sake of asking. Make sure that there is a logic behind every question that you ask. All right. So yeah, and then the S stands for the severity, and this is like very important. Most people miss out the severity part because it's just so like at the end of the entire Socrates, and a lot of time just because the candidates are not asking about the severity, they end up missing a diagnosis. And how you're going to phrase this question? You're going to say that, okay, can you please scale your rate your pain on a scale of 1 to 10 for me, with 1 being the lowest and 10 being the most unbearable pain that you've ever had. Okay, and that is how you're going to frame your question. That is how you're going to ask this question. Okay, and why is it important? Just think about the differential diagnosis of subarachnoid hemorrhage. Okay, subarachnoid hemorrhage is the worst headache of the life. Okay, a patient coming with subarachnoid hemorrhage is going to give you a mixed history. Okay, you would keep on getting confused between migraine, meningitis, and you would not be able to come to exact cause until you ask about the severity. And once you ask about the severity, the simulator will give you this thing that, okay, yeah, doctor, this is the worst headache I've ever had. Even a scale of 10 is less to grade the kind of headache that I'm having right now. Okay, so always ask about the severity. It is like very important. Okay, so this is how you're going to explore the pain. Okay, Socrates. And as I mentioned that since you have to ask about an open-ended question in the beginning, so there is a very strong possibility that when you ask about the open-ended question, the simulator may, answer 3 to 4 questions from your Socrates. Okay, so make sure that you're not repeating those questions again. Let's suppose that in the open-ended question, the simulator he said that, okay, yeah, doctor, I'm having pain in my left side of the chest. Okay, and just because the Socrates and the side part is there in your mind, after asking the open-ended question and after acknowledging that, you end up asking again that, okay, can you please tell me where exactly are you having the pain right now? Okay, so this will really affect your data gathering marks as well, and this will also affect your IPS as well, because it would show that you're not actively listening to the patient. All right, so always make sure that you do not repeat any of these questions, because repeating will only do more harm, or harm in your data gathering, harm in your IPS, and most importantly, it will really affect your time management as well if you keep on just repeating the questions, and it wouldn't leave your time to ask the relevant questions and the questions that are important. Okay, so that is the first part, that is the first layer that I call about data gathering, that is exploring any symptom. Okay, so this was the Socrates. Now comes the OD para. Okay, the next mnemonic is OD para, or the OD para, whatever you pronounce it. Okay, now, Odipara is something that is used for any other symptom. Okay, apart from pain. If the patient is presenting to you with vomiting, diarrhea, weight loss, weight gain, burning micturition, lump in the breast, okay, or lump anywhere in the body, any symptom you name it, okay, bleeding, shortness of breath, okay, anything apart from the pain, okay, then you're going to use the mnemonic of Odipara for exploring the symptoms. Okay, now what is the OD para? The O stands for onset. Okay, that can you please tell me since how long have you been having this vomiting? Okay, and can you please tell me since how long have you been losing weight? Okay, uh, and did it start gradually? Sorry, onset was basically, so can you please tell me, like, did this weight loss begin suddenly, or is it happening gradually? Did this vomiting begin gradually, or has it started to happen suddenly? Okay, and then the duration is that, okay, can you please tell me since how long have you been having this weight loss? Can you please tell me since how long have you been having this vomiting? Okay, so O for onset and D for duration. Okay, then I stands for intensity. Okay, instead of the severity, you go for the intensity. Can you please tell me that how severe is it? Is it affecting your daily life? Okay, are you not even able to eat a single bite before vomiting? Okay, so that is how you are going to explore the intensity of the situation depending on the symptom that is there. Okay, then P for progression. Okay, progression is that, okay, has it got worse over the time? That, yeah, doctor, initially I was losing 2 kilograms in a month, but now I have noted that in the last month I have lost around 5 kilograms of my weight. Okay, so the progression is rapid. That means that this disease is progressing. Okay, can you please tell me how your vomiting have been since the past 2 months? Yeah, doctor, initially I used to have vomiting 2 to 3 days in a month after I had my meal, but now, doctor, I am having it every day after every meal that I am taking. Okay, so the P is for progression. Okay, then comes the A. A is basically the aggravating factor, okay, and the relieving factor. Okay, instead of the exacerbating factor, we name it as the aggravating factor. Okay, and then the R basically is the relieving factor. Okay, that anything that makes the vomiting better, anything that has reduced your tiredness, anything that has reduced the burning maturation. Okay, and then the last A is for the association and anything else. Okay, and as I mentioned that I'm going to talk about the association and anything else in a while now. Okay, so Socrates and Odipara. Okay, these are the two things that you need to remember for the very first layer. Okay, it depends on the type of symptom that you're encountering in the exam, and that is something that will help you in exploring the symptom. Okay, so before I move on to the association and anything else part, let me tell you that it's very, very important that before moving on to the flaw and the P data, that are the second and the third layer of the history taking, it is very important that you are able to list down 2 to 3 differentials in your head after you're done with the first layer. Okay, all the other layer is just for the supporting your diagnosis, just to even make your diagnosis even more clear and make you more confident on your diagnosis. Okay, so you have to make sure that the Odipara and the Socrates is done in a flawless way. It is done in a very, very good, in a very, very detailed way, and you're not missing out on things, because if you miss out one thing in this Odipara or Socrates, there is a very strong possibility that you may not be able to reach to the diagnosis. Okay, so you need to keep that in mind. All right, so I just hope that I've made the Socrates and the Odipara thing quite clear. Okay, now let's move on to the association and anything else. All right, now what is this association and what is this anything else? Okay, and why is it very, very important? Okay, let me just switch the tab. All right, yeah, so this association symptoms and anything else, this is something that I advise my students and my candidates to use in order to cover one very important aspect of the exam, that is the art of ruling out differentials. Okay, now the Plat 2 examiners are like very, very concerned about the fact that, okay, if this particular candidate, or if a particular candidate knows how to rule out the red flags or knows how to rule out the differentials. Okay, and even though, like, even if you're done with the Socrates and you immediately know that, okay, this is myocardial infarction or this is pulmonary embolism, even if you're able to come to the diagnosis, even if you're very well aware of the case, and you're able to pick it up in initial 2 to 3 minutes of your consultation, or initial 5-10 questions of your consultation, despite that you should have an approach of asking this association and anything else factor, just to make sure that you are giving that impression to the examiner that, okay, about the differential diagnosis. Okay, different differentials. Okay, and you are aware that how to rule them out. Okay, and it is like very, very important. Okay, and how you're going to do that, like, for example, I told you that you need to have a approach that starts from the symptoms. Okay, like, for example, in this case we had a chest pain. Okay, so as soon as the chest pain comes, there should be 5 to 7 differentials of chest pain that should come in your mind, that should come in your head. Okay, and after you're done asking the Socrates, okay, then you should focus on the associated symptoms. Okay, like, for example, as you can see that in the MI, you ask about the radiation and all. Myocardial infarction is associated with sweating and vomiting as well. Okay, so ask that okay, Mr. John Green or Mr. Green, by any chance, are you experiencing any sweating? By any chance, apart from this chest pain, are you experiencing any vomiting? Okay, that will further help you come to the diagnosis in a much more confident way. Okay, then pericarditis. Okay, pericarditis. There is a recent fever or flu-like illness that is a major risk factor of pericarditis. So you can ask that, okay, Mr. Adam, was this chest pain associated with any fever or flu-like illness a couple of weeks ago? That would really help you reach to a diagnosis of pericarditis, or if not reach to the diagnosis, but it will help you hint towards pericarditis if you're thinking that, okay, this is pericarditis. Okay, pulmonary embolism would be linked with shortness of breath and leg pain, or any recent travel or any recent surgeries. Okay, uh, the gastroesophageal reflux disease. Okay, by any chance, this chest pain, is it associated with food intake? By any chance, does this burning in your chest happens after you take food? Okay, then if it's shingles, you're going to ask that, okay, by any chance, is there any rash that is present on your chest? Okay, erythemias, chest pain may present with palpitations. By any chance, do you feel that your chest pain is associated with rapid racing of your heart? Okay, heart failure, a patient of heart failure presenting with chest pain may have ankle edema. Okay, so by any chance, Mr. Green, are you having any swelling in your legs? By any chance, are you having any shortness of breath? Okay, so this anything else, okay, or the association can be a very vast thing. Okay, and this is the particular component of the history that will help you rule out the differentials. Okay, that will help you rule out the red flags. Okay, and I've prepared a list of all the differentials and what are the questions that you need to ask in order to rule out that particular differential. Okay, I'm not going to go in a lot of detail and read all of them, but what I'm going to do for you is that I'm going to scroll it down so that you can have an idea. If you want to take a screenshot of it to make sure that it's there in your notes, you are welcome to do so as well. Okay, so yeah, for the headache, you're going to ask about association with photophobia, stiffness, neck stiffness, okay, phonophobia, and subarachnoid hemorrhage. Neck stiffness would be there, photophobia would be there. Okay, migraine, you're going to ask about the aura, if you see any silver lines, if you have any visual or auditory disturbances. Okay, um, then analgesic overuse headaches. Okay, you're going to ask about that, is it associated with any recent use of paracetamol? Hangover headache, any recent use of alcohol and all. Okay, then trigeminal neuralgia. Okay, this is something that you pick up on, aggravating factor, that does it increase on chewing, or does it increase on touching or not touching your jaw? Okay, then we have got GCA. You're going to ask about, is there any tenderness in your scalp? By any chance, are you having any problems with the vision as well? Okay, and then these are the the differentials that you need to rule out when it comes to the back pain. Okay, renal colic will be associated, the back pain of renal colic will be associated with urinary complaint. BPH would also be associated with the urgency and frequency. Okay, prostate cancer will have weight loss as well along with back pain. Okay, ankylosing spondylitis improves with exercise and hot shower, so the aggravating and the relieving factor would be there. Sciatica, the pain would be associated with numbness in thighs as well. Okay, cauda equina, urinary incontinence, saddle anesthesia, are you able to feel any sensation on your buttocks? Okay, so these are the questions that you're going to ask. Then uh, like numerous differentials for stomach ache, if it's in the right upper quadrant, your differentials would completely change, and the history that you're taking, that would completely change. If it's in the epigastric region, then your differentials would change and the questions would change. And then the right lower quadrant, the differential would change again. Okay, and in the left lower quadrant, the left lower quadrant and the right lower quadrant, differentials are like more or less same, like except appendicitis, that is only there in the right lower quadrant. Okay, then we have got a few differentials for diarrhea that you would have to explore. Okay, then dysphagia, like it very rarely shows up, but there are few cases that of esophageal carcinoma, specifically, and Barrett's esophagus, that you're going to see in the exam. Okay, falls, hyponatremia, can present with a lot of things. It can present with tiredness, confusion, okay, and the presenting complaint may be falls. So you need to ensure that the hyponatremia stations, okay, like there are 5 to 6 different scenarios of hyponatremia presenting in different ways, either by tiredness or confusion or falls, okay, and it can be and in the exam the cause is due to either oxybutynin or thiazide diuretics or uh, COPD or SIADH. You need to uh, like make sure that the hyponatremia cases uh, are read up, and you're well aware of what the hyponatremia cases and the causes are and how to rule them out. Okay, and then the tiredness, as I mentioned, that hyponatremia also presents as tiredness. Okay, so you need to have that in mind. Then other causes of tiredness: iron deficiency, vitamin B12. Okay, like iron deficiency, if you're exploring iron deficiency, you can ask that, okay, is it associated with any bleeding from anywhere? Okay, and then you can explore the diet as well. Okay, then vitamin B12 deficiency, leukemia, thalassemia, obstructive sleep apnea, depression as well. Okay, depression also often presents as tiredness. Okay, and many people don't are unable to reach to the diagnosis of depression just because it presented as tiredness. Okay, then a couple of differentials for joint pain, uh, and how to rule them out, and then weight gain, increase urinary frequency, then leg pain as well. Okay, so yeah, this is it's a very detailed document. Okay, I can't just like go through each differential over here. It's going to take a lot of time. It's going to make the video very lengthy. So I've just shared the basic idea with you, and I've shared the differentials, and I hope that you've taken the screenshots of it so that you're aware, and when you're practicing, you use this thing. Okay, sorry about that. All right. So that was the very first layer. Okay. Now let's just move on to this next layer of the data gathering of the medical history taking. Okay. That is the flaw. Okay. Flaw is basically stands for fever, lump, appetite, and weight loss. Okay, so it's important to rule out flaw because this is what are the red flag sign. Because if somebody is having fever, lumps and bumps in the body, loss of appetite, weight loss, okay, the patient may be having some infectious pathology, or the patient may be having sometimes some type of carcinoma or some type of cancers. Okay, so this layer is like very important. Okay, if you haven't asked about the fever, if you haven't asked about the lump or weight loss in the associated symptoms, okay, or in the anything else part, okay, over here, then make sure that this thing is there in your head as a second layer, in which you have to ask that by any chance are you running any fever, any lumps and bumps in the body, any loss of appetite, or any weight loss that you must have noted in the past couple of months. Okay, so you have to ask this question. And with this, one very important thing that I would like to teach you. Okay, and it's a very important tip, and it's a very important trick that will really help you manage a lot of your time. Okay, now what people do in the exam is that they end up forming the sentence in a very long way. Okay, like for example, if they want to ask about fever, what they're going to do is that they're going to say that, okay, Mr. John, by any chance are you having any fever? Okay, that is one way of going about it. Okay, and if you are able to manage your time, okay, if you feel that, okay, your data gathering is so good that you can manage the time by even after making sure that your questions are like structured in a very long and a time taking way, then fine, you can say it like this, if that is the natural way of you to go about it. But what you can do, if you're unable to manage your time, and if you feel that you're always getting short on your data gathering, try to shorten the question. Like, instead of asking that by any chance are you having any fever, just say any fever. Okay, by any chance are you having any lumps and bumps in the body, any lumps and bumps in the body, by any chance have you lost weight recently, Any weight loss recently? Okay, so by any chance, have you lost any weight recently? You end up using 4 seconds, okay, for 3 to 4 seconds of your time, and any weight loss would hardly take 1 second. Okay, so you're saving up to 3 seconds on one question. Okay, and there are like what at least 15-20 questions that you're going to ask. So just imagine you're going to save a minute. Okay, if you use this approach, and that 1 minute would be very very useful when you would be explaining your management. Okay, so try to develop this habit of shortening your data gathering, and try to use the word any instead of by any chance. Other than that, are you having any fever? Okay, apart from this, are you having any fever? Any fever, any weight loss, any lumps and bumps in the body. Okay, so try to use the word any, and that is really going to help you shorten your data gathering, because that is something that helped me as well and a lot of my candidates as well. Okay, so try to use that. Okay, so the first layer and the second layer is done. Okay, fever, lumps and bumps, appetite, weight loss. Okay, now let's move on to the third layer. That is called the PDASA. Okay, now what is the PDASA? PDASA is the past medical illness. Okay, past medical illness. You could ask it like this: that by any chance, are you do you have any medical condition that I should be aware of? Okay, that is one way of asking the question. Okay, by any chance, are you having any medical condition that I should be aware of? Okay, but then as I said earlier on, that it's always important to be very specific in your data gathering. Okay, let's suppose that you are having a chest pain. Okay, the patient is having chest pain. Okay, and you are suspecting till now, till this history, you're suspecting that the patient might be having a myocardial infarction. Okay, or acute coronary syndrome, whatever you call it. Okay, then the past medical history for diabetes, for hypertension, for any other cardiovascular disease will become important. Okay, so instead of asking by any chance, are you having any other medical condition that I should be aware of, you could frame your questions in a way that is more specific and much more time efficient by saying any diabetes, any hypertension, any cardiovascular diseases. Okay, so try to always try to be specific. There would be some times, there would be few instances where being specific would not be possible. Okay, so do not just force yourself to be specific everywhere, but make sure that wherever you can be specific, try to be specific. Okay, so you're going to explore the past medical history. Somebody presenting with palpitations. Okay, even though it's arrhythmias. Okay, you have come to the diagnosis that okay, the patient might be having atrial fibrillation. Okay, or SVT. Okay, or any kind of arrhythmia. That is why the patient is having palpitation. But despite the fact, you have to rule out thyroid. Okay, you have to rule out thyroid disorders. So instead of asking by any chance, do you have any other medical illnesses that I should be aware of, and then expecting that the simulator is going to say, yeah, doctor, I have had hyperthyroidism in the past, or no, doctor, I do not have any thyroid related issues. Just ask the patient directly, by any chance, did you have any thyroid related issues in the past, or any thyroid related issues in the past, to save time. Okay, so exploring the past medical history is very important, because it will help you come to the diagnosis. Okay, diabetic retinopathy case, you're going to be confused. Okay, you're going to be confused at the very end. You would not be able to rule out just on the basis of the OD para that okay, this is going towards diabetic retinopathy. Okay, unless you ask about the past medical history, that by any chance, do you have any diabetes? Okay, and they say, yeah, doctor, I've had uncontrolled diabetes for a very very long time. And then you would be able to connect your dots that okay, this patient is having gradual vision loss, and the patient is also saying that he's having uncontrolled diabetes, and I'm unable to rule out and unable to come to a particular diagnosis. Maybe the patient might be having diabetic retinopathy, and then you'll direct your examination and direct your investigations along the lines of diabetic retinopathy. So very important part. Okay, then it's P DASA. Okay, now what is DASA? DASA is the diet, exercise, smoking, and alcohol. Okay, this particular section becomes much more relevant in those cases where the diet, is exercise, smoking, and alcohol does play a role. Okay, like for example, in the MI case, okay, diet would be important. That okay, can you please tell me if you eat out a lot, if your diet consists of fast food, okay, by any chance can you can you please tell me if you're physically active, or by any chance do you smoke, or by any chance do you take any alcohol, okay. So all of these things like becomes very important in MI cases or in cardiovascular cases. Okay, so always make sure that you are able to filter that. Okay, where should I be asking these questions? Like for example, if somebody's coming to you with a complaint of burning maturation and you're suspecting UTI, okay, the diet and exercise will not be relevant, okay. Even the smoking may not be relevant in that case, okay. Alcohol to some extent, okay, you can think about it that alcohol may be relevant if you talk about the long-term complications of alcohol, okay. But do not just ask those questions just because Dr. Sarosh taught that, okay, in the third layer you have to do P days. I'm going to do P days everywhere. No, okay, it's there for your understanding. Okay, it's there for your to correct your approach, to correct your structure. But you have to use your brains that whether or not a particular question is important for this case or not. Okay, like somebody presenting with burning maturation, the diet is not important. Okay, yeah, instead of diet, what you can say that you can, associate water intake in the section of diet, and then you can ask, can you please tell me how is your water intake? How many glasses of water do you drink in a day? So instead of diet, replace it with drink. Okay, still related. But can you please run me through your diet? Do you eat healthy foods or not? Okay, may not be relevant in a case of UTI. Okay, but yes, if it's a case of renal colic, okay, then you may ask about the diet. Why? Because high cholesterol leads to stone. Okay, uh, having a diet rich in tomatoes can lead to magnesium oxalate stones being formed. A calcium rich diet may lead to calcium stone formation in the kidneys. Okay, so there the diet may be important. Okay, so always use your brain that, okay, if you're asking about the diet, why are you asking? Okay, is there a logic behind it? Are you trying to further establish your diagnosis? Are you trying to rule out a particular differential? Okay, are you trying to establish a risk factor in order to get a better and a deeper understanding of what the case is? Okay, so always make sure that you know the logic is there. Okay, do not just blindly follow what is there in the notes. Do not just blindly follow what is being taught. Okay, you should be using your brains and asking very relevant and very specific questions. Okay, you do not have a lot of time, candidates. You do not have a lot of time. There will always be a time constraints and a time crunch involved. Okay, and you have to make sure that you're using your time very wisely. Successful candidates and good candidates and those candidates who pass their exam in their first attempt or pass their exam with 14 15 stations are the ones who are able to understand that where they want to use the time, where they want to, and how they want to invest the time in the station. Okay, how do they want to use their 8 minutes? Do not just be an average candidate. Do not just keep on asking questions here and there just because it is there in the script, just because it is there in the notes, just because it is taught by Dr. Sarosh. It doesn't matter. Okay, why I'm teaching you this is because some of it may be relevant in some cases, some of it may not be relevant in a lot of cases. Okay, the structure needs to be there in your mind, but what to use from that, that is something which you need to develop. Okay, so yeah, that is the third layer. All right, now let's move on to the fourth layer, fourth and the last layer of the data gathering. Okay, that is meftosa. Okay, what is meftosa? Meftosa basically stands for, M stands for the medicines that you might be taking, A stands for allergies, F stands for family history, the T stands for recent travel. So the O stands for the psychosocial. Okay, I call it the psychosocial. Okay, in the psychosocial, I'll tell you what to ask in the psychosocial, but just keep it in mind that O stands for psychosocial. Okay, then the S stands for the sexual history and A stands for anything else. Okay, now I'll tell you what each and every component of it is and how you're going to ask about it. Okay, so the M stands for medicines. That is the drug history. That, okay, what medicines you are taking. Okay, and how you're going to ask it that by any chance are you on any long-term medications. Okay, that is one way of asking that question. Okay, but as I mentioned earlier on, you have to be specific. Okay, you have to be specific. Do not ask a question just for the sake of asking. Okay, so if there is a case of mi, okay, or just forget about mi, okay, if there is a case of chest pain, okay, and you are trying to rule out pulmonary embolism, okay, then you have to ask about it like this, that okay, by any chance are you taking any oral contraceptive pills. Just make sure you're asking this question to a female, okay, because it's in the script. People, I've seen people in my mock asking a male patient that by any chance are you on any oral contraceptive pills, okay. So do not be that idiot, okay. Make sure that you don't let the pressure of the exam get in your head and end up making silly mistake like these, okay. So yeah, directed questions: by any chance are you on blood thinner medications? Why? Because if you're suspecting subarachnoid hemorrhage or a stroke, or if the patient is presenting to you with pervaginal bleeding or rectal bleeding, okay, then by any chance are you on any blood thinner medications? Okay, directed questions are very very important. Okay, you should, give that impression, give that hint to the examiner that okay, he's following the script, okay, he's following the right structure, okay, he knows what meftosa is, he knows what flaws is, he knows what desa is, but he's not just asking it randomly just like an average candidate. Whatever he's asking or whatever she is asking, there is a logic behind it. He or she is thinking that okay, I'm going to ask about OCPs. Why? Because I know that OCPs is a risk factor for pulmonary embolism. I'm going to ask about blood thinner. Why? Because I know that blood thinners is a risk factor for hemorrhage. Okay, diabetic patient, hypoglycemia patient coming to you unconscious after a fall. By any chance, are you on any insulin? Okay, so make sure that your questions are like very very specific. Okay, then comes the allergies. Okay, by any chance do you have any allergies? And this is the thing, like allergies is something which okay, so there are two different reasons why you may ask about the allergies. Number one, the complaint that patient may be presenting must be related to an allergy. Like for example, if the patient is presenting to you with a skin rash, okay, or if a patient is presenting to you with runny nose or sinusitis or headache on the forehead or facial pain, okay, and you're thinking about sinusitis, then you may think about allergies, okay, that okay, this patient might be having some allergies. Or patient, if somebody is, as I mentioned, having a skin lesion or a skin rash, then you may ask about the allergies, okay. So that is one scenario in which you should ask about the allergies, okay. Other than that, if you're prescribing a medication which may lead to allergies, like for example, if you're discharging a patient or starting an antibiotic in a patient, okay, the patient may be allergic to it. If you're starting an opioid or a narcotic, the patient may have some allergies to it, okay. So if you're asking the allergies for, making sure that you are a safe doctor and making sure that you prescribe safely, then that logic is acceptable, and that logic is correct, okay. I have seen people asking about the allergies in a lot of counseling session, when where the patient just wants to know about endoscopy. The patient wants to ask about colonoscopy, and people just end up asking questions like, "Do you have any allergies?" Like, I just want to learn about a procedure right now. I'm not here to get any medical intervention from you. I'm here to get information about the procedure. Okay, why do you want to ask about the allergy? Okay, somebody, let's suppose that somebody is presenting to you with a chest pain, okay, having an mi, okay, it's a life threatening condition, and all you're concerned about is okay, are you having any allergies? The patient is might just collapse right now, okay. Just shorten your data gathering, just move on to the important things, okay. Like for example, in the mi case, if you've got limited time, past medical history would be important, okay. The medicine that you're taking may or may not be important, okay. Yeah, you can ask about the blood thinner medication, that if the patient is already on any blood thinners, so that you don't give any extra doses, fine. Family history would become more important, travel history would become more important, okay. So do not just ask about the allergies where it's not relevant, unless you are prescribing antibiotics or those medications which have known allergies, okay, like sulfa drugs, okay. So do not like ask this question just for the sake of asking it. It does sound stupid. Somebody's holding his chest and coming to the A&E and with a chest pain, suspected MI, and you're asking, okay, by any chance, do you have any allergies? I don't care if I have any allergy or not. You're going to manage MI despite you're going to give him oxygen, you're going to do the angioplasty, you're going to do the angiogram, and you're going to give nitrites and aspirin despite that as well. Okay, so you need to make sure that your questions are like very well directed. Okay, then the F stands for the family history becomes very important in all the cancer cases, in MI, in the patient present with diabetes. Okay, so ask about that. By any chance, or does anyone in your family have a similar condition, or by any chance, does anyone in your family have a condition that I should be aware of? Okay, then any recent travel. Okay, now why do I ask about the travel is very very important, not just in the case of the pulmonary embolism, but there are a few diseases that you have to suspect if the patient has traveled somewhere. Okay, let's suppose that the patient has traveled to Thailand recently. You're going to suspect malaria. Okay, if the patient says that, yeah, doctor, I went to a camping trip recently. Okay, you can think about the Lyme disease. Okay, Nigeria and Kenya have very common cases of malaria. Okay, it's very common in those region. Then if you move to South Asia, India, Pakistan, Bangladesh, Nepal, dengue is like very very common. Okay, somebody presenting to you with fever, weakness, okay, and has traveled to South Asia, the patient may be having dengue hemorrhagic fever. Okay, and any travel can lead to scabies as well, because you share hotels. Okay, you check in at different places. Okay, because of the hygiene issue, scabies is also like very very common. Okay, so that is why travel is important in a few conditions. Okay, because if somebody has traveled to a particular country, you may think about the diseases and the infectious pathologies that are common in those countries or in that particular country. Okay, so make sure that you're asking about the travel, make sure that you are inquiring about the travel. And you can ask about the travel in terms of the medical aspect. Like for example, somebody had a recent travel, then they might be having pulmonary embolism because of a long flight. Okay, so the logic needs to be there. Okay, why you are asking about the travel history? Are you suspecting any endemic diseases, okay, like malaria, dengue, okay, or scabies? Or are you trying to rule out a pathology, or are you trying to rule out or trying to figure out the reason why the patient may be developing a symptom that he has developed, in order to further establish your diagnosis, in order to further and much more confidently come to a diagnosis. Okay, so that is like a very important part. Then moving on to the psychosocial aspect. Okay, the psychosocial aspect, the O in the in the layer. Okay, so psychosocial aspect is like really important. Okay, it is something that you should develop a habit of asking every time, every time. Okay, because because it may be relevant clinically, it may not be relevant, but you need to understand that UK is very particular about the psychosocial aspects. Okay, specifically the mental health. Okay, so you have to ask a couple of questions when it comes to the psychosocial aspect, that how has your life been in general? Okay, do you have got friends and family with you for your support? Okay, second question. And the third question is, what do you do for a living? Okay, if the occupation is important. So there are three questions to the psychosocial aspect. How has your life been in general? Okay, it's a very general generic question, and gives you a lot of aspects of the psychosocial parameter, and the psychosocial health of a patient. Just ask a very open-ended question, that how is life in general, how is everything at your end nowadays? Okay, and if it's a chronic disease, then you can ask and you can modify this question, that how has this particular condition change your day-to-day life? Okay, how are you coping up with it? Okay, if it's a depressive condition, if it's a chronic condition. Okay, then you may want to ask about that, if the patient has got support system available. Like for example, a patient of chest pain, he comes to you alone having an MI, you would want to call someone from his family. Okay, you would want to call someone for his support, that okay, is there anyone in your family that you would want to call? Is there anyone in your friends that we should be aware of, in case we want to discuss anything. Okay, so very important aspect. And then occupation, what do you do for a living? You can skip this question, okay, if you feel that the occupation is not very very important. Like, yes, there are few occupational diseases, like for example mesothelioma. Shipyard worker or navy worker may develop mesothelioma. Okay, you may want to ask about it. But occupation, somehow or the other, it kind of becomes a very important question. Like for example, if somebody is presenting with falls, vertigo, tinnitus, you may want to ask that, okay, what kind of work do they do? Okay, do the work on heights? Okay, or do they drive as well? Okay, psychosocial aspect also has one more very important criteria, that is, by any chance do you drive? Because there are a few diseases in which you need to make sure that the patient is not driving the car. Like for example, TIA, stroke, diabetic ketoacidosis patients, patient who had a recent MI. These are the patients who are not supposed to drive. Epileptic patients. Okay, so this is a vast aspect. Okay, psychosocial aspect, and you have to inquire about these things, and it really depends. Okay, like on scenario to scenario, you may ask all of these things, and all of them may be relevant. Okay, or in a few cases, some of the psychosocial aspect may be relevant, and some of the psychosocial aspect may not be relevant at all. Okay, so just remember these 3 to 4 things, that how are you coping up with the situation, and how is your life in general? Do you've got friends and family members to support you? What do you do for a living? And by any chance, do you drive? Okay, so make sure that you've asked these 4 questions, or amongst these 4 questions, whichever question is relevant, you have asked this particular thing in your data gathering. Okay, then comes the sexual history. Okay, I'm not going to go in a lot of detail of the sexual history right now. You may want to just slightly touch upon the sexual history. Like, let's suppose somebody presenting to you with a right lower quadrant pain. Okay, and it's most likely to be appendicitis. Okay, but you just want to rule out ectopic pregnancy. So you just may want to ask a couple of sexual history questions, that when was your last menstrual period? Are you sexually active? Do you have a stable partner? Okay, just a couple of questions, just to rule out the sexual or the gynecological aspect of it. But there are a few sessions in which you have to do a sexual history in a lot of detail. Okay, and we are going to talk about it when we'll cover the structure, and we'll cover the approach that we need to take for the gynecology and the obstetricians. Okay, so that is why I'm not going in a lot of detail of the sexual history. Okay, then the A stands for anything else. Okay, and anything else is can be literally anything else that you may have missed. Okay, or maybe the patient have said something that you further want to explore. Okay, so it can be anything else, anything that you have missed, anything that came up in the conversation with the patient that you further want to explore. Okay, so just ask that particular thing to finally complete your data gathering. Okay, so yeah, this was the 4 layers, okay, that you need to make sure, and that you need to remember when it comes to the data gathering, and when it comes to the history taking. Okay, so after this, you must have realized that data gathering is not as simple as it seems. Okay, there are so many questions, so many different aspects to it, and then you have to be very specific. You have to make sure that you're managing the time well. You need to have differentials in your mind. You need to have an eye for looking out for the risk factors. Okay, you need to think about the psychosocial aspect as well. Then you need to think about safety as well, that okay, allergies, you have to ask about the allergies. You need to ask if the patient drives or not, if the patient's occupation is affecting a particular disease or a particular symptom. Okay, so it's a very very broad approach, it's a very very holistic approach, because apparently it just looks like that, okay, I just need to do Socrates, Odipara, flaws, Desa, Meftosa, fine, I'm done, just 4 to 5 different layers. But the depth of those 4 to 5 different layers, and that is why it took me like a good 50 minutes to teach those 5 layers, because it's not as simple and as straightforward as it seems.